So I will be covering topics on exercise and diabetes and covering the introduction, the type of exercises, the benefits of exercise with people with diabetes, the exercise guidelines available, and the associated risk and prevention, the person-centric approach of exercising, and the different exercise programs that I have come across. So as CDC defines exercise as a type of physical activity that's planned, structured, repetitive, and done to maintain or improve the physical health. And as we know, exercise is one of the cornerstone or the most important pillar of diabetes management, along with diet, medication, and monitoring. And it is one of the first management strategies advised for the people with newly diagnosed type 2 diabetes or pre-diabetes. However, the response to exercise varies significantly between people with type 1 and type 2 diabetes due to its different physiological mechanism underlying the condition. Now, what are the type of exercises and what are its effects on blood glucose level? The different type of exercises have different effect on blood glucose level. The aerobic exercises, these are those exercises like walking, running. Such exercise generally lowers the blood glucose level by increasing insulin sensitivity and glucose uptake by the muscle. However, the prolonged physical aerobic activity may increase risk of hypoglycemia, particularly in people with type 1 diabetes. And the other form is the anaerobic exercise like strength training, which can temporarily raise the blood glucose level by increasing the counter-regulatory hormones. And over the time, it improves insulin sensitivity and helps in maintaining blood glucose level post-exercise. Uh, the benefits of exercise, of course, it has multiple benefits on muscles, on the overall physical health, on fat tissues, on memories. So the first in diabetic is the glycemic control. For people with type 1 diabetes, exercise can enhance insulin sensitivity and reduce the amount of exogenous insulin required. However, people with type 1 diabetes need to monitor their blood glucose level very carefully just to avoid both hyper and hypoglycemia as the exercise increases glucose utilization by muscle. In case of type 2 diabetes, exercise significantly improves insulin sensitivity by aiding glucose uptake by muscle and reducing the blood glucose level and potentially delaying the disease progression. In a regular regimen, exercise regimen can lead to reduced medication and improve the glycemic outcome. Now, one of the study from diabetes care which I came across on exercise was this one. That is, there were 497 adults with type 1 diabetes. They were randomly assigned exercise, that is aerobic, anaerobic, and interval exercise. And blood glucose level were the outcome, and time and target was the outcome that was measured. So the measurement was based on CGMS, the insulin delivery, continuous heart rate monitoring, food intake, the sleep pattern, everything was measured. And the primary results showed that mean decrease in blood glucose level in people with aerobic exercise was minus 18, followed by interval exercise group that is minus 14 degrees, and with resistant exercise that was minus 9 degrees in mean blood glucose levels. And if we see the secondary finding, the time and target, it was almost same for three of the groups. It was same. It was around 76%. So the study concluded that the greater drop in blood glucose occurred with aerobic exercise as compared to interval and resistance. However, significant improvements in daily time and target occur only with three forms of exercise, and several event level and participant level factors influence the blood glucose responses to exercise, which may need to be considered for the development of new automated insulin delivery system. The other rapid review that focuses on type 2 diabetes, and this study was aimed to analyze the relationship between the physical training variables like the, of course, type of exercises, the frequency, duration, and the progress. And it was found that the HbA1c level significantly decreased in the included reports by all the studies. And similar improvement in HbA1c level were found after high intensity training exercise. And of course, the other parameters that improved were the blood pressure, the anthropometric measurements, and body composition, and the overall fitness of people with type 2 diabetes. The other benefit of exercise is cardiovascular health. And physical activity improves cardiovascular health by lowering the blood pressure level. It enhances the lipid profiles, that is, increased HDL cholesterol and reduced LDL cholesterol. And exercise promotes the cardiac protection by improving systematic cardiovascular risk factors, endothelial and vascular functions, and other cardiovascular performance. The other thing that exercise can help is weight management. Weight management, weight reduction with an intensive lifestyle intervention has been shown to reduce the incidence of diabetes by 58%. The landmark trial, that is look ahead trial, had shown that loss of 5 to 10% of body weight can improve fitness, can reduce HbA1c, can improve cardiovascular health risk factors, and decrease the use of diabetes, hypertension, and lipid lowering medications. So additional benefits of weight loss includes decrease in depression symptoms, remission or reduced severity of obstructive sleep apnea, and greater clinical improvements were observed with greater weight loss. Now, there are different exercise recommendations given by different organizations. So, the ADA 2024 says that an adult with type 2 diabetes should get at least 150 to 300 minutes of moderate intensity aerobic exercise per week or 75 to 150 minutes of vigorous aerobic exercise. And they also recommend strength and resistance training at least twice a week. The ISPAD recommendation, the International Society of Adolescent and Pediatric Diabetes, that works for people with type 1 diabetes, suggests that the moderate intensity aerobic exercises like walking, cycling, could be done between the meals for 15 to 45 minutes, which can safely lower the blood glucose level up to 190 milligram per dl. However, they also emphasize the insulin dose adjustments, mostly in the aerobic exercise, and less likely it is required in very high intensity or aerobic exercises, which is more commonly associated with elevated blood glucose level. So, a post exercise insulin correction for hyperglycemia may be considered in such circumstances. And in all form of exercises, high glycemic index carbohydrate should be available to prevent and treat hypoglycemia. And a wide range of insulin adjustments and nutritional strategies can combine to keep blood glucose levels in range during exercise and prevent exercise induced hypoglycemia. And exercise is recommended to be regularly discussed as a part of routine diabetes care as we do diet and other many other examples in any of the patients. The WHO recommendation says that World Health Organization guidelines says that the children and adolescents should do at least 60 minutes per day of moderate to vigorous intensity aerobic exercise across the week. And vigorous intensity aerobic activities and that strengthen the muscles and bones should be incorporated at least 3 days a week. And for children and adolescents, should limit the amount of time spent being sedentary, particularly the amount of recreational screen time. Now, what are the associated risks and how can those be prevented in people with diabetes? So, the first risk of exercise in people with diabetes is exercise-induced hypoglycemia or nocturnal hypoglycemia. Now, exercise-induced hypoglycemia is common in people with type 1 diabetes, and to a lesser extent, it is seen in people with type 2 diabetes who are using insulin or who are using insulin sufficient. Hypoglycemia events occur typically between 6 to 15 hours post-exercise, although risk can be extended up to 48 hours. And exercise-induced hypoglycemia can lead to exercise reluctance, which can hurt the individual's health. Now, to prevent it, the risk can be minimized by 20% reduction of the daily basal insulin with reducing prandial insulin as well, and low glycemic index carbohydrate feeding following evening exercise for those on multiple daily insulin. So, a person with diabetes should think ahead to reduce the likelihood of hypoglycemia for up to 24 hours after exercise or delay hypoglycemia. By evening, insulin dose may be needed to be reduced and adding 15 to 30 grams of carb at bedtime if afternoon and evening exercise has been undertaken and it is strenuous, and making sure the bedtime glucose level is above 130 milligram per dl. The carbohydrates that has to be consumed during exercise, during all form of exercise, high glycemic index carbohydrate should be available to prevent and treat hypoglycemia. And the amount and type of carbohydrate used in relation to exercise should be tailored to specific activity. And advising supplementary carbohydrate for hypoglycemic prevention should aim not to increase the total energy intake, above expenditure, and the use of snacks should not be decreased dietary quality. And adequate amount of fluid should be is essential and it reduce the risk of dehydration. The other thing is exercise-induced hyperglycemia, which is also common in type 1 diabetes, and it can happen because of purposeful omission of insulin before exercise, which can raise the glycemia. And individuals with type 2 diabetes may also experience increase in blood glucose after aerobic or resistance exercise, particularly if they are insulin users and administer too little insulin before meal or before activity. And overconsumption of carbohydrate during or before exercise, along with the aggressive insulin reduction, can promote hyperglycemia during exercise. And the only way to prevent it is correction dose. 50% of the usual correction dose need to be administered, or aerobic cool down may be done to lower it. And excessive insulin correction after exercise may increase nocturnal hypoglycemia risk, which can result in mortality. Now, few safety tips for people with diabetes to avoid the risk are like, find a friend who can walk out with them so that he or she can help you with any of the unseen accidents. The other thing, let people know that you are living with someone, so you are someone living with diabetes by wearing the diabetic band or any such thing you find fancy. Always carry food pouches and snacks to prevent the risk of hypoglycemia. And the most importantly, monitoring and monitoring are the, it is one of the safety tips to prevent this risk associated with exercise and exercise with diabetes. The other thing is, many a times the patient comes and says that, is it okay to exercise with diabetes? But most importantly, they should alter the question and ask if it is okay to exercise with diabetes rather than how to do it with diabetes. So I would say it is a complete person-centric approach. One size does not fit all. So the first step is setting and adjusting the person-centric activity and goal. Knowing the person, how his activity or his or her activities goes, what is his goal, whether he want to go for the weight management plan or whether what are his personal experience, how much he is capable of doing. So we need to discuss that thing, discuss the exercise type, what kind of exercise will suit him, discuss the exercise timing and insulin action, conceptualizing the risk of hypoglycemia. Diabetes education, which is another important point, should be thoroughly explained to the patient, and we need to review the results and for further adjustments and plans at each visit. The other thing is the exercise program that I have come across. This is from the Al Bawasir in Qatar. I attended two little girls with diabetes to this camp where they taught self-management of diabetes to children. And here it was made sure that exercise was one of the most important part of the self-management. And every morning they were taught how to exercise and how to do it with diabetes. So such programs can help motivate and help to build a habit in children of exercising with diabetes. The other thing, the other health program that I came across was the Health Challenges program. It was in the city of Ahmedabad. It was open for everyone. It was not specifically for children, for people with diabetes, but it was open for everyone. Where they made sure that people eat right food, they exercise on time, they do all such things that can help them to keep physically fit. So such programs can help people with diabetes to lead a healthy life, and most importantly they motivate for such challenges like to eat better, to get proper sleep, to do exercises. So it was one of the good programs that I came across. And on the extreme right hand side is the book by Ginger is someone living with type 1 diabetes, and this book recommendation is her experience of exercising with diabetes, which is a good book for people with diabetes, and I would recommend this. And in summary, I'd say that exercise play a very important role in diabetes management through multiple benefits of it. And regular exercise not only helps to control blood glucose level, but also strengthen the cardiovascular health and supports weight management goal. By incorporating appropriate exercises into their routine lives, people with diabetes can significantly improve their overall health outcomes and quality of life. So exercise is not just a movement for those with diabetes, it's a medicine in motion. So every step is the step towards better control. This is said by Dr. Sarah Klepp, and thank you so much. Thank you for the opportunity. Thank you, Dick.